You are listening to Confessions of a Counselor podcast. Here we will talk all things mental health in bite-sized chunks. Hello and welcome to Confessions of a Counselor. I'm your host, Janice, and in today's episode, I thought we would talk about another crucial conversation around neurodivergence, and that is what makes therapy different and or effective when we are looking at using therapy as a tool for supporting our neurodivergence. Let's jump right in. So if you've ever been to therapy before and felt like, oh, this isn't quite working, or it doesn't quite feel right, I'm not sure what's happening here, but this doesn't feel like it's helping me, this is because sometimes that traditional therapy approach doesn't always work for someone who's experiencing neurodivergence. So the traditional therapy models focus on a neurotypical brain and doesn't necessarily explore that there might be something else happening in the background. So when it comes to working with therapies and supporting our neurodivergence, I think it's really important to note some of the differences that we might need to address when asking for help with therapy. So how is therapy different? First, it starts with understanding the brain's unique operating system. So instead of fixing the neurodivergent traits, saying this is abnormal or different or not working, can I instead take this from a neuro-affirming therapeutic approach and say, this is how I operate differently. This is how my brain works differently. This is how my brain functions in a way. And so if I can start to understand that, and I can start to understand what is this operating system and start to put the puzzle pieces together to understand my experience, then I can start to recognize and understand things like sensory sensitivities or communication styles or executive functioning differences, and start to support how my brain works rather than working against the way that my brain works. So when we can start to understand this, we can really start to take a step back and start to affirm what's happening for you, the individual, versus trying to, again, fit you into a box that may or may not work for you. Second, when looking at neuro-affirming therapy, is looking at a strong emphasis of collaboration and individualization. So we want a therapy that's working for you, the person, versus you, the person, working for the therapy. So this isn't about the therapist being the sole expert, or me as the therapist saying like, this is what's happening, or this is what you need to do. And this is something that you hear me talk about a lot in the podcast, is that like, you are the expert in your life. You know you best. I've got lots of tools and skills that we can use, but it's about pulling them out and seeing if they work. Or maybe it's about pulling them out and then adapting them slightly so that they can work for you. So it's not about me being the expert. It's about you being the expert in your life. This is also about how can we support the therapeutic environment, right? So I have a box of fidget tools in my office that you're more than welcome to play with and use and access. I often will change lighting or change seats with someone depending on what they need. So it's really about understanding the challenges that you're having, and then how can we support the therapeutic process with those challenges, and also understanding the strengths, right? How can we use our neurodivergence as a strength and find ways that we can use coping skills to enhance those strengths? Third, as we're talking about therapy and the differences that neuro-affirming therapy can have, is that we are shifting this focus from pathology, there's something wrong with you, into what are my strengths and challenges. So traditional models can sometimes inadvertently reinforce this idea that neurodivergence is a deficit, right? Or even other mental health ailments can be seen as a deficit. There's something wrong and we need to fix it. So the therapeutic approach that I have taken, even before I knew what neuro-affirming therapy was, is that there's nothing wrong with you, right? There's nothing we're trying to fix. There's nothing we're trying to change. You are not a broken human. We are just trying to enhance your experience. We are trying to find ways to make life feel better for you. So we're going to find your strengths and find the things that work for you, and then work with the challenges that you're experiencing and find skills that support those challenges to be less challenging. So this is a way of, again, kind of understanding our brains and understanding how things look, feel, or are different for you. Therapy becomes a journey of discovering and harnessing those strengths that you have, helping you to build self-worth in your authentic self rather than trying to fit yourself into a box of what we're supposed to be. Fourth is increasing the focus on unlearning that ableism that kind of comes up when we're talking about neurodivergence. Typically, we use frameworks that are neurotypical, this is what most people experience, this is the norm, this is the correct standard deviation away from blah, 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 that you're supposed to be, which leaves many of us who experience neurodivergence feeling like we are wrong, or we need to change, or we're not doing it properly, or you need to adapt to the environment, not that the environment needs to adapt to you. You need to adapt to the people in your life versus them having some understanding and adapting to us. So therapy can start to unpack some of these beliefs that you are in the wrong, or that you have a deficit, or that you aren't showing up appropriately, you're not human enough is another one that I've heard. So can we start to unpack that and start to find ways that we can recognize that you are not broken, there's not something wrong with you, it's just different, and that's okay. We need that biodiversity, because if we were all the same, that wouldn't work either, right? So finding ways to accept and acknowledge and appreciate the differentness that we have. And finally, active therapy for neurodivergent people often involves practical strategies. So this is one of the things that I talk about. I always want to be leaving session with something to think about, something to do, something to try or change. And these need to be tailored to you, the person, right? So I always say this when giving out homework pieces is, come back and tell me, did it work? Did it not work? Is there something that we could change about it that would help it feel better for you? So that, again, that constant communication. So this is about developing coping mechanisms and understanding strategies and coping strategies that work for you and your unique set of challenges. So whether that's sensory overload or executive function struggles or communications skills that you feel like you're missing, right? So as we start to look at these, can we start to build routines or build coping mechanisms for sensory overload, whatever that looks like? So can we start to work those practical strategies to your needs and what you need, versus, again, some of the more traditional therapies say, this is what you do in order to feel better. So that's never really been my approach, but as I'm starting to learn more about the neurodivergent community, it's more learning that there's even more unique ways that we can tailor things in the therapeutic process to you, the person. So ultimately, therapy for the neurodivergent brain is about creating space where you are not just tolerated, but celebrated. You are the center focus of the therapeutic process, and we're tailoring and tweaking and creating so that you get the most out of that therapeutic experience without the expectation that you're going to fit into a box or a certain set of rules or a certain set of statistics. So instead of asking the question, what is wrong with me? We're going to move towards the question of, how does my brain work and how can I support its unique strengths and challenges? So if you are neurodivergent, we are looking for therapists who specifically state that they are neuro-affirming in their approach and that they understand that process. That's something that you can ask in an intake form or a consult, right? So we want to start looking for therapists who are taking this approach and using this approach to support their clients. Thank you so much for joining me today. And remember that your brain is a gift. And I hope that you were able to find someone who is using a neuro-affirming approach to therapy and helps support you in moving into the best version of yourself and living the best life that you can. Until next time, take care. hope you enjoyed today's episode. Confessions of a Counselor podcast is available anywhere you like to listen to your podcasts on Apple and Android. New episodes are released every Friday. If you enjoyed today's episode, please join the conversation. Leave a review or subscribe to the podcast hosted on Spotify. You can find all these details on janicelyons.com. Until next time, take care.